Good evening, everyone. I am Bijou Star. Of course, you can hear me on the midday show with Sam Silk on 93.1 WZAK. And welcome to Get Healthy, Stay Healthy Conversations with MetroHealth. We are so happy that you are joining us this evening in the midst of whatever you are doing. Of course, we're all virtual. We're all at home, so it's okay. You can get comfy and sit back, relax, because we're going to have some fun tonight. And don't worry if you hear babies in the background. I know everybody's got things going on, and we do too, but we're going to have a good time getting you some great information about getting healthy, and that's what counts right now. So let me just let you know what's going down tonight. So the MetroHealth System and Urban One have teamed up to bring you conversations about how to stay healthy during this pandemic. Today, we are going to be covering the importance of getting necessary health screenings, all right? Learn how to overcome those barriers that may prevent you from getting a screening, necessary screenings for men, women, and children, and how to schedule a screening with MetroHealth. Now, to help us with all this information tonight, I have a special guest, Dr. Bell. Could you come on in?
Hey, everybody.
Hi,
Thanks,
Dr.
Bijou. How are you?
I'm good. Thank you so much for joining us this evening. So we've got a lot to talk about. Got to get some information from the professional herself. All right. So Dr. Bell, you are a family medical doctor, right?
That's correct.
All right. So that means you can treat a bunch of different things. You kind of treat. You're like, we can come to you when we have any type of issue.
Yes.
Okay. Great to know. All right, so let's get into the questions, Dr. Bell. We do have, some people have a lot of questions. So if you do have questions while we're talking, just want to remind you that you can type them on the side right here in our chat. You can leave those comments and we will get to them after we are done with our conversation. So I know sometimes you can forget. So just go ahead, type them while you're thinking about them, and we'll get right over to them when we're done with our conversation. Now, so Dr. Bell, why is it important to keep up with screenings, especially during this time?
So screenings are so important. I love doing screenings. This is probably one of the most favorite things that I can do in the office. Screenings keep you healthy. So we are able to find out if you have any medical conditions, detect them early so that you can get treatment, and then we can actually prevent medical conditions. So coming in, once a year for that physical exam, that annual exam, that's where we either do the screenings or give you the referral for the screenings.
Got you. So now what are some of the barriers? Because I know there's some things to hold people back from getting those screenings. So what are some of those things?
So, the pandemic is probably the biggest thing since we had the lockdown in March. People weren't comfortable coming into a healthcare setting. They were afraid about, catching COVID. But hospitals, we have put so many precautions in place. It is very safe to come in for your screenings. The other thing is time. We're all busy. Children are doing remote learning. A lot of us are in that sandwich generation where we're taking care of kids, but we're also taking care of parents. And we just don't make time to come in to see our healthcare provider and get those screenings. But it's so important to do those screenings now and to stay healthy now so that you're healthy in the future.
Yes.
Another thing is cost. People are worried, I don't have extra money to pay for these screenings, so I'm just not going to come in. But for most insurance companies, they actually pay for these screenings. They're considered preventative screenings, so they're usually covered at 100%. Now, there are other people who are concerned, I don't have insurance at all, so how I'm going to be able to cover the cost of the screenings? And that's when you reach out to us at Metro. We want to take care of you. So you can contact us at Metro. We're going to give you assistance, and we'll help you determine benefits that you have through our hospital.
Awesome. So we know sometimes you're like, hey, I feel good. I don't need a screening, or I don't need to go to the doctor. I don't feel anything. But we do know that can be kind of misleading at times. So if you feel okay, should you still be checked and screened for cancer?
Yes, you should still come in and be screened because for men and women, there are important things that we want to screen for. A lot of the screenings help detect cancers, but they also can prevent cancers. So for women, the first two I'm going to talk about are specifically for our female listeners. One is breast cancer screening. We start at ages 50 to 74, and that's done every other year. But if you have a family history of like breast cancer, you're high risk, some medical societies say we should screen earlier and screen more frequently. And that's the importance of having what we call a primary care provider, or people often hear a PCP. That's why it's important, because you come in and we have that discussion with you about, do you have risk factors? When should you come in for screening? When should you start screening? How frequently it should be done? So we're not actually doing cookie cutter medicine. We're actually treating you like an individual and getting your needs. So the first thing is that the breast cancer screening. The second is cervical cancer screening. So women may have heard of HPV, the human papilloma virus. That's a virus that causes cervical cancer. So when I was growing up, we started that screening at age 18. You went in and got your pap smear. The recommendations have changed. We start that screening from at age 21. And women from 21 to 29, they come in every 3 years to get their pap done, which is where we actually get a sample to look at your cervical cells to see if there's any precancers or cancerous changes. When you're 30 and through the age of 65, you have a couple of options. You can go every 3 years if we do the pap smear alone, or you can go every 5 years. We can do the high risk HPV testing alone, or we can combine that with the pap smear, and that's done every 5 years. Now, I don't want to leave the fellows out, because there's some screening that our men need along with women, and that is colon cancer screening, or you may hear about colorectal screening. And so that starts at the age of 50, and that goes to age 75, and that's for average risk. And so what we do is we look at your risk. And if there's a family history of colon cancer, or you have a history of polyps, which are growths that can be precancerous and turn into cancer, or if you have a history of inflammatory bowel disease, which is something like Crohn's disease, then we may screen you earlier. But again, that's a discussion. Definitely come in, because we want to talk to you to look at your risk and determine if we need to screen you earlier or more frequently. If you opt to have the colonoscopy, which is where a camera is actually put in to take a look at your colon, and that's normal, you get that done every 10 years. Some people opt to have what we call the fecal occult blood test, which people know as the stool cards, where we look for blood. That's done every year. But again, those options, you should talk with your healthcare provider to see which option is best for you.
Got you. And just, I know a lot of people don't understand. Sometimes in your mind, you're like, well, these are older people issues, but younger people, like you said, I just want to emphasize, you still, if you have a family history, that's the importance of having your doctor who you have a relationship with, because we just lost, we literally just lost one of our greats. Black Panther. Okay. We just literally, he was I don't think he was, what was he, 45? He wasn't old at all, maybe in his 40s. And we have lost him to colon cancer.
Correct.
So you got to think about it. It's not always, an older person who may need these screenings. You definitely want to check, even when you're younger. You have to check, if I have a family history of breast cancer. So I've got to check earlier. My mom is a survivor. So my story is a bit different, but that's like you said, the importance of having that relationship and talking to your doctor. You may feel okay, but you still want to check. So that's great information right there. So to some people, heart issues come as a shock, as they don't recognize the warning signs. So can you share to the audience how you can actually screen people for heart issues?
Yeah, but a lot of times people come in and see me and they say, I feel fine and everything's great, and I don't think I'm going to have a heart attack or any heart issues. But what we do is people 40 and over, and especially those who are overweight and obese, we're going to go ahead and we're screening you for diabetes, because diabetes is a risk factor, a huge risk factor for heart disease. But we also look at other things. We're going to check your blood pressure. We're going to check your cholesterol. We even get down to the nitty gritty. We're getting that social history. Are you a smoker? Because there are some things that will put you at greater risk for heart disease. So we are constantly, when you're coming in, the back of our minds are always thinking, what things can we prevent? And if you have any medical conditions, what can we do so that they're not creating complications later on in life?
So I know high blood pressure is an issue for a lot of people, especially in our community. All right.
Mhm.
So how often should people get screened for that?
Okay. So, 40 and over, we want to check every year. We want you coming in. That's the importance of that annual physical exam, because we want to check your blood pressure and we want to make sure it's in the normal range. Those who are between 18 and 39 will check every 3 to 5 years. But if you have risk factors, you're overweight, pre-diabetes, you're a diabetic, there's a family history, you may have high cholesterol, we may actually screen you sooner, but we want you to come in.
For sure. That's the first step, just coming in. And that's what we're
Yes.
talking about. So a lot of screenings that you mentioned today, they should be at least 18 or over. Now, are there screenings? Those are just for adults, or are kids also do they need to get screened for these as well?
Yep. So kids need to be screened. We love the kids and we want the kids to be healthy as well, because the family is so important. We need a strong family unit. So mom, dad, grandma, grandpa, but even the kids need to stay healthy as well, because what we do now impacts our future. So we start screening even when children are newborns. We do the newborn screen before they leave the hospital to make sure that they don't have any medical conditions that can prevent them from growing up and developing appropriately. We also do the newborn hearing screen to make sure that we screen for hearing loss early. And then as children come in for their well child visits, we screen for lead, we screen for anemia, we check blood pressure, we check blood sugars. If there's risk factors, we can screen for cholesterol. And then also with those well child visits, they get those important shots that they need to keep them healthy as well. So yes, screenings even occur when you're younger.
Okay, so how can people get in contact with your doctors to schedule these appointments and these screenings? Because we know we need them now.
Yes, so we want you to come in. We love taking care of people at Metro. I enjoy my job and I love patients coming in every day. So we want you to visit metrohealth.org/appointments. You can find out benefits. If you don't have insurance, you can schedule an appointment. We have several locations available, but we want you to get healthy. We want you to stay healthy.
Yes. All right. So we actually have a question, and that is, are you available to do follow-up appointments via video or by phone, Dr. Bell?
Yes, with the pandemic, we have learned that telehealth is awesome. So we're able to see patients via telephone or video, so right at the comfort of their home or at their job. So even if you don't feel comfortable coming in, we can definitely see you for those follow-up visits via telehealth.
So with telehealth, just so because I still, we're all kind of getting acclimated to telehealth and the virtual visits. You still get the same type of attention. You're talking directly to the doctor. I'm kind of like this, right? Where I'm talking to you.
Mm-hmm.
And then we're also able to get, you're able to prescribe medicines or, for blood testing. You can do all that literally just from the screen or the phone.
Exactly. We can order tests, we can refill medicines, we can take care of a multitude of things via the phone or video. So it's amazing. We're living in this age where you never thought that you could see your healthcare provider, video or over the phone, but this is awesome. We have taken care of so many people during the pandemic and making sure people stay healthy.
That's awesome. Well, we all know that we need our screenings. We know how important they are. And at the end of the day, please don't put them off. Like you said, it really is only most of these that you talked about just once a year annually. So it's not something that should take up too much time, and you can just plan around it knowing, and it makes you feel better once you know. Once you get checked and you're like, whoo, all right. I'm good. I'm good now.
Yes.
I'm good. It's one of those things that you just want to do, get it over with. And then when you see how cool Dr. Bell is, why, of course you want to go to MetroHealth and see Dr. Bell. Come on.
Yes, exactly. Yes. So we want you to come out. We want people to get healthy. We want them to stay healthy. Don't let fears, don't let any barriers be an issue. We are here to help you out. We are your biggest champs. We're fighting for you. So don't hesitate to visit metrohealth.org/appointments, because Screenings are so important. We want to keep you here and we want to keep you healthy.
Yes, yes. And if there's anything else you want to add, Dr. Bell, feel free to do it. We thank you for giving us so much great information. If you want to add one more thing or just, a reminder for us to make sure we get our butts there to get our screenings.
Right. Get your screenings and don't forget, get your flu shots. We're recommending everyone get their flu shots by Halloween. That gives you 6 months of immunity that will keep you through the flu season, especially with us going through the pandemic. So make sure you get your flu shot.
All right. Well, thank you so much, Dr. Bell, for talking with us this evening. And once again, you can see going across the bottom of the screen exactly where you need to go to get your appointments right there and check out Dr. Bell and the other awesome doctors there at MetroHealth. Thank you so much once again. And we will be seeing you soon to get our health together.
All right. Thank you, Bijou. Take care. Thanks, everybody.
Great evening. And thank you so much for joining us.
Thank you.